you could be doing all the right things for your bone health, lifting weights, eating well, taking your supplements, but still not getting results. And the reason actually might be sitting in your medicine cabinet. So here's something that should concern all of us. Over 40 million Americans are prescribed medications known to negatively impact bone. These include PPIs, steroids, SSRIs, certain diabetes drugs. That doesn't even include the over-the-counter users. And use of these medications tends to increase with age. For example, more than 50% of women over 65 are on a PPI or an SSRI. That's wild. Both are linked to higher fracture risk. And nearly 1 in 4 adults over 50 are taking NSAIDs or sleep aids on a regular basis. Yet, almost none of these people are being screened for osteoporosis early, if at all. And that's the real issue. We actually don't have an osteoporosis awareness problem. We have an osteoporosis detection problem because we're not looking early enough, especially in women in their 40s and 50s who are taking these medications. We're missing an opportunity to prevent or reverse osteoporosis before it becomes a bigger deal, before we see these fractures. Today, we're going to be talking about the top 6 medications, 3 prescription and 3 over-the-counter, that have been clinically proven to harm your bone density or increase fracture risk. And some of these are incredibly common, prescribed or taken by millions and millions of people, and yet bone loss is rarely mentioned or noted as a side effect. So you guys know I'm always looking for unique supplement combinations. And I was pretty excited when I saw this one from 4Well called Advanced Formula Saw Palmetto for Men. Now, the company 4Well has only a couple of products, and they only put out unique formulations like this one, which has DHEA, saw palmetto, and ashwagandha. Now, you've heard me talk a lot about DHEA before. So DHEA is great because it's an androgen. It's good for your brain, for your bones, testosterone balance, body composition, muscle mass, etc. But especially at doses like this at 50 milligrams, we see androgenic side effects in some of our patients, and that includes me as well. So there would be like acne and hair loss, etc. So that's why they combine it with saw palmetto. Saw palmetto is a 5-alpha reductase inhibitor. Actually works the same way as some of the drugs that are used for hair loss. It blocks the conversion of testosterone to dihydrotestosterone, which could be a major contributor in many cases. So I've actually started taking this product, and guess what? No androgenic side effects. Now, the third ingredient, ashwagandha, is a really popular adaptogen. It's in a lot of products because it can help balance cortisol. It helps with hormone balance, testosterone balance. It's really popular with men in libido support products, etc. So ashwagandha is never a bad thing to add in, and it probably adds just a little element of calming to the whole thing. So if you've tried DHA in the past without success, I would consider trying this combo out. And if you click on the link or use the code Dr. Doug, the number 4Well, Dr. Doug 4Well, you'll get 10% off. Now we're going to start with the prescription side. So these are prescriptions that would come from your doctor, and these are the top 3 as I see it. Number 1 is steroids, prednisone, or other glucocorticoids. These drugs are used to treat inflammation. They're used to treat autoimmunity. And this could be a situation like asthma or certain autoimmune conditions like rheumatoid arthritis. And while it could definitely be life-saving, there's certainly a time and a place to use these drugs. Long-term use is one of the most well-known and well-documented causes of secondary osteoporosis. And yet, actually, a lot of people still don't know this even when they're on these drugs. And it's not even just prednisone. I want to go through some of these other names too, because a lot of times people don't understand what they're taking. So prednisone is one version of this. Methylprednisone, sometimes called Medrol, dexamethasone or Decadron, hydrocortisone, Cortef, Solu-Cortef, triamcinolone or Kenalog. These are all steroids in the same class, and all of them, if taken systemically over a long period of time, will result in bone loss. Studies show that bone loss can occur with doses as low as 2.5 milligrams per day. That's an equivalent of prednisone. And if you do that over the course of several months, which is very common, especially in autoimmunity, then bone loss is pretty predictable. The risk starts to go up dramatically as the dose grows up. This is definitely dose dependent, and it's also duration dependent. So the longer you're on these drugs, the more likely you are to be suffering from bone loss. Now, these drugs suppress bone building activity or osteoblast activity, meaning that you're going to have fewer bone building cells. And you're going to actually increase the osteoclast, which is the cells that break down bone. You're going to increase their lifespan, which ultimately means more bone loss over time. So even low doses over time can increase fracture risk, and the spine is where you're going to probably want to look for these changes first. And I recently reported on this interesting thing around glucocorticoids, which is that if you are on an anti-resorptive drug for bone, meaning a bisphosphonate, a Fosamax, a reclast, or a Prolia, and you're also on glucocorticoids, your risk for some of the things that people really are concerned about with these drugs, like osteonecrosis of the jaw, atypical femur fracture, these risks go up by up to 10 times in people who are on these drugs and on glucocorticoids at the same time. So these things are definitely not benign. So if you're on prednisone or another steroid long-term, you absolutely need to have a proactive bone health strategy that includes imaging, not just DEXA preferably, but REMS, quality, etc. Ideally be doing resistance training and optimize HRT, etc. So if you're on steroids, you really need to be fighting for your bone quality and quantity and monitoring to make sure you're not losing it too quickly. All right, drug number 2. So this is a certain type of diabetes medication. Diabetes is so common and people like to take oral medications over injections for lots of reasons. So there's a certain diabetes drug class called TZDs. And when it comes to diabetes drugs, definitely there's a range, right? Some of them are considered to be healthy and good for longevity, like metformin. Others can be pretty dangerous. So TZDs would be drugs like Avandia, Actos, and they have been shown to increase fracture risk, particularly in women. These drugs work by increasing insulin sensitivity in fat cells, but they also appear to promote adipocyte or fat cell formation over osteoblast formation in bone marrow. Remember that osteoblasts actually come from the same stem cell as fat cells. So that's why when you see patients with osteoporosis, a lot of times their bones are filled with quote unquote fat. And that's just because the cells that were making osteoblasts were told to make fat cells instead. And this is part of that signaling pathway. Ultimately, that means that fewer bone-forming cells and more fat are going to be in the marrow, and that's not a trait that you're looking for if you're looking to improve your bone health. And here's the hard truth. I've been in the nutrition space for a long time, especially working with my wife's company, PhD Weight Loss, where she helps people with obesity and being overweight and letting go of weight and reversing diabetes. Because diabetes is not generally an insulin deficiency if we're talking about type 2 diabetes, adult onset as it used to be called, although now it happens in younger and younger individuals. But if your pancreas still works and you are insulin resistant, that can be reversed through diet. So with the right nutrition strategy, strength training, support, many people can dramatically reduce and oftentimes eliminate all medications, essentially reversing diabetes through the right lifestyle approach. So these are drugs that we really shouldn't have to take anyway if we can understand the root cause, the foundation of diabetes. So if you're on a TZD and you're also dealing with osteopenia or osteoporosis, it's probably worth a conversation with your provider about alternative options, because there are a lot of actually good alternative options. I'm going to talk about one of them. But you could also just decide to improve your nutrition, reverse your diabetes, and then you wouldn't need these altogether. Now, I said that there were 3. I'm actually going to talk about 4, but the second one or the third one here is actually in the diabetes realm as well, but most people now are thinking about these in the weight loss space. That would be the GLP-1 drugs. So this would be like semaglutide, which is Ozempic, and Wegovy, or tirzepatide, which is Mounjaro. These drugs, GLP-1 and GIP receptor agonists, have totally revolutionized the way we treat type 2 diabetes, the way we treat diabetes in the conventional medical model. And while they have many benefits, their effects on bone are still, I would say, a little either misunderstood or not well studied in the long term. So remember, this is Ozempic, Wegovy, Victoza, Saxenda, Trulicity, Mounjaro. All of these things have these same potential risks. So if you look at some of the studies, and I've done videos on these topics, if you look at some studies on GLP-1s, you'll see that there is a thought that they should actually improve bone density. But those studies are on diabetics who are not actually losing weight. So I think it is possible that these drugs could actually benefit bone metabolism and bone turnover through their antioxidant, anti-inflammatory pathways. But in the weight loss space, we see something different. In the weight loss space, where people are trying to lose weight, because these drugs are so effective, you can see rapid weight loss with big time underconsumption of calories and protein. When you do that, the studies would show that you'll lose 40% of the weight that you lose in lean mass. Lean mass means muscle, but it also means bone. So these people are losing bone, and we know that this is true based off the literature, and I definitely see it clinically in people who are losing weight quickly who are not paying attention to their bone health. So while the number on the scale may be going down, if you're losing strength, if you're losing your bone health along with the fat, you could really be setting yourself up for failure because your body is going to want to rebound from that. And many times patients on GLP-1s without the right lifestyle approach will end up fatter, lighter, but fatter, and then they will gain the weight back, and then they're in a worse place than where they started. So if you're using a GLP-1 medication, the key is to pair it with muscle-preserving strategies, protein-forward diet. You're going to restrict your calories by default when you're taking these drugs, so make sure that the calories that you're getting are high-quality protein-forward. That's the most important piece. Also, optimizing hormones whenever possible. So for women, postmenopausal women, that's HRT. Perimenopausal women, if you think you have a hormone imbalance, get that checked out. Men, take a look at your testosterone. These hormone imbalances run along with obesity very, very frequently. So optimizing your hormones is a way that you are going to be able to both balance out the lean mass loss, but also encourage better improvement through the exercise that you should also be doing. So I hope that makes sense. So the number 3 drug is SSRIs. So this would be antidepressants like fluoxetine or Prozac, sertraline, Zoloft. SSRIs are very commonly prescribed for treating depression and anxiety, but they also disrupt bone remodeling, especially in postmenopausal women. They seem to affect serotonin receptors in bone cells. I've told you that these bone cells, these bones are communicating all over the system, right? They're communicating with all these different systems, and serotonin is a neurotransmitter, and yet there's receptors for serotonin on bone cells. Pretty wild. But what happens is if you're impacting the serotonin receptors in bone cells, you're going to tip the balance more toward bone breakdown. And we see this pretty consistently in the literature on SSRIs. There was a published meta-analysis that showed significantly higher rates of fracture in chronic SSRI users, even independent of fall risk. So I'm not telling anybody to stop their antidepressant. Please, this is not medical advice. But if you're on an SSRI, and you have low bone density, it might be time to have a conversation with your provider who's prescribing it to talk about potential alternatives, if there are any, or really get aggressive about your bone health. So now let's move on to the over-the-counter side, because this is where it gets really sneaky. So the number 1 thing here is proton pump inhibitors, or PPIs. So PPIs, some people take these things like candy. They seem like they're over the counter. They're not risky. I want to be able to eat my pizza, so I'm going to take my Prilosec. Then remember, if you go back with these drugs, when they were first released, they were prescription only, for sure. And they were actually recommended to be used for very short periods of time, like a week or 10 days, because they were considered to be so powerful. So what once used to really only be used in settings like the ICU in the hospital, now people are eating these things, again, like dinner mints, because they want to be able to consume the foods that cause them acid reflux, cause them GERD. And this does help. They are effective. You certainly see that in the advertising. You probably see it in people around you. But when we reduce stomach acid, which is what these drugs do, it impairs our ability to absorb calcium, especially calcium supplements, but even calcium through diet, magnesium, and it also reduces our capacity to break down protein, and that is a big deal. So I want to go through all the names of these drugs, or at least many of the big ones, because it's really easy to not know that you're taking a PPI if you're not in the medical space. So that would be drugs like Nexium, Prevacid, Protonix, Acifex. These are drugs that are commonly utilized. Many of them are over the counter, and I think they are abused in a lot of cases. Studies are interesting on PPIs because your doctor will tell you that it doesn't have an impact on bone density, and they'd be right because this is what the drug companies tell them. And they're not wrong. If you look at studies on PPIs and bone density doesn't go down, but fracture risk does go up. This one's confusing. And ultimately, remember, we care about fracture risk more than we care about bone density. So there are actually some studies that show a 30% increased risk of fracture with the use of PPIs. So when it comes to PPIs, the thing is that, yeah, they are helpful with symptoms, but we're not treating the underlying cause of the symptoms in most cases. There is a time and a place to take PPIs for sure. And the thing around the need for PPIs is that most people are kind of told that the cause of their heartburn is too much stomach acid. I hear this frequently. The truth is, the stomach acid isn't the problem, unless you have a structural reason why stomach acid could be a problem. In general, it's not the stomach acid. It's the fact that it's being pushed up into your esophagus, into the tube that connects your mouth and your stomach is likely being pushed up there because of other factors, because of your diet potentially, or because of dysbiosis. You could have an H. pylori infection. It is possible that you could have like a hernia, or you could have a dysfunctional sphincter. And those, again, are mechanical reasons why you may actually need a PPI or you need to have surgery. But most people are dealing with some stomach dysfunction, and they're covering up that dysfunction with a PPI. So really what they need to be doing is figuring out, do I have something that I can treat, working with a dietitian who is an expert in gut health, who can help you to identify what the issues are, treat those underlying issues, and then you don't need the PPI anymore. And I want to point out just some special scenarios. If you have been diagnosed with something like Barrett's esophagus, please talk to your doctor before you discontinue your PPI. There are other reasons, again, like I said, hiatal hernia, dysfunctional sphincters. These are areas where the PPI is just preventing you from having these precancerous changes, which is what Barrett's esophagus is. So again, there are reasons to use these drugs, but most people are not using them for these reasons. Another special note here, there are other drugs which sound similar, and I have a hard time keeping them separate in my mind, but things like famotidine or Pepcid, cimetidine, Tagamet, these are actually H2 blockers. So this works to reduce stomach acid in a different way. They're not as powerful. They don't act for as long. So these drugs actually are not associated with reduced bone density or increased fracture risk. And I think they can be used short-term, intermittently, for people that do have some reflux, that do have some occasional need, help with sleep, whatever. I prefer for my patients to use H2 blockers over PPIs if they can. All right, number 2 over-the-counter drug that I think is concerning for bone health is NSAIDs. So these are non-steroidal anti-inflammatory drugs. So this would be like your ibuprofen, Advil, naproxen, Aleve, lots of these over-the-counter drugs. The challenge with these things is that if we look at what they do work for the things we say to use them for, right? They are anti-inflammatories. They can help with pain. They do reduce inflammation. And occasional use is probably okay for most people. But chronic use, especially daily for pain and arthritis control, it definitely is going to have an impact on your gut, and it very well may actually impair bone healing as well. So NSAIDs are an interesting class of drugs because it seems like what they do shouldn't be bad for us in any way. And that's why when I was going through orthopedic residency, we used to say, let's just put NSAIDs in the water in the lobby, and then everybody will feel better and we'll be great. But the truth is that NSAIDs are blocking inflammation. Inflammation is actually an important tool in the repair process, the bone healing process, especially in acute trauma, but I think long-term as well. We need the body to be able to go through the inflammatory process. We don't want it to be ramped up chronically, but if we're blocking it constantly, there's negative downstream effects. So if you're taking Advil on a regular basis, again, I'm concerned that it's going to be bad for your gut, and it also may be having a negative impact on your bone. So some alternatives to consider from the functional medicine space would be like curcumin, which comes from turmeric. You could consider something like boswellia. You can consider just omega-3 fatty acids, which a lot of you are probably taking anyway. These are anti-inflammatory over-the-counter supplements. Magnesium, vitamin D also actually have a positive impact on the inflammatory process and are probably safer to use in the long term. All right, the last one we're going to talk about is Benadryl or diphenhydramine. And the reason why I bring this one up is actually not because it reduces bone mineral density. It doesn't. But I have a lot of people that come into our practice who are using Benadryl as a sleep aid. And it is in a lot of sleep aids because it definitely does make you drowsy, right? It's a first-generation antihistamine, and it's going to be used in both sleep aids and allergy meds, and it will work. Like, it helps people to fall asleep. It does help with the histamine reaction from allergies, but it also can impair balance, coordination, and cognition, especially in older adults. That means a higher fall risk, which especially in our elderly who might already have weak bones, is a recipe for fracture. So again, it doesn't reduce bone mineral density directly, but it does increase fall risk in people who are waking up groggy, tripping at night, having to go to the restroom. If they feel sedated during the day, the risk of fracture just goes up. So if you're using it for sleep, there's a lot of better options. So some of the things we recommend for our patients would be like magnesium glycinate or magnesium L-threonate, mag-L-threonate. Theanine is a great herbal product that helps to reduce the cortisol and balance cortisol to help with sleep. GABA or pharma-GABA, some people call it. Adaptogens like ashwagandha can be really helpful. Melatonin, obviously, we've talked about. So there's a lot of tools that we can use rather than Benadryl. So I would, for our patients, encourage them to get away from Benadryl for chronic use. Again, just have it around if they need it for the true allergy side of things, but I wouldn't use it chronically for that either. Okay, so that's kind of a lot of information. So what do we do with this? So the first thing is, if you're taking some of these drugs or over-the-counter medications, don't panic. Know that knowledge is potential power, but now we have to act. So if you're on any of these medications long-term, it doesn't mean that you're doomed to osteoporosis, but it just means that you need a plan. And it should include a thorough evaluation to see if you actually need to be on these things, or if a root cause approach can actually help you to get off of these things. This is also a time to consider, are you missing some additional tools that could help just tip that scale for you in the favor of bone health, optimizing hormone optimization, better targeted supplementation, strength training, impact training, whatever it is. If you're interested in learning more about those things, or if you're interested in learning about the mistakes that people do around those things, you could consider joining our masterclass. We do this for free, either every week or every other week. And link is in the description on YouTube. And again, we talk about the tools that we see helping people to collapse their bone health journey and see success more quickly. So that's it for today. Remember that life should be about honoring your health, making memories, and aging with strength and grace. I'll see you in the next video.